Hi everyone, welcome to another episode of Psych Talk. Today I will talk about hoarding disorder. I would like to start this episode by reading a case study as I did with my episode on narcissistic personality disorder. And this case study is presented in a book called Selecting Effective Treatments, a comprehensive systematic guide to treating mental disorders. So here we go. Luisa was a 50-year-old divorced woman with a prior history of depressed mood and impulsive shopping. Luisa was raised in a close-knit Hispanic family and following her divorce 25 years ago, had moved into an apartment with her mother. Everything was fine until her mother died 5 years ago and Luisa went into a persistent depression. She stopped cooking because it reminded her of a meal she had cooked with her mother and made her feel sad. To lift her spirits, she would go shopping and buy herself pretty things that made her feel better. Because she didn't need and rarely used any of the items she bought, they accumulated on the kitchen table, the countertops, and even on top of the stove. Over the years, the clutter became so deep that Luisa had to forge a pathway through the kitchen to be able to access the refrigerator. One day, she could not find her postage stamps, so she stopped paying her bills. When the landlord knocked on her door to ask for the rent, Luisa opened the door to let him in. It was then that the landlord saw the extreme clutter all around the apartment. The landlord called the fire marshal, and Luisa was given notice that she had 60 days to clean up the mess or she would be evicted. Her brother, who lived far away in El Paso, Texas, wanted to help, so he hired a cleaning company to come once a week to help Luisa sort through her possessions and clear away the mess. But when the cleaners came, Luisa became overwhelmed with the massive amount of decisions that needed to be made. She insisted on evaluating each item herself to determine if it should be put into bins labeled keep, discard, or undecided. Within 2 hours, she had several boxes full of things to keep and nothing in the undecided or discard bins. Luisa became overwhelmed and locked herself in the bathroom with her cat. The cleaning company had worked with this situation before. They provided Luisa with a referral to a therapist and suggested that the therapist might be able to help Luisa reduce her anxiety and come up with a plan to move forward. Luisa made the appointment reluctantly, knowing that she had to do something or she would be evicted from her apartment. At the first appointment, the therapist was kind and compassionate. Luisa expressed her anger toward her brother for getting involved in her business and talked about her continued sadness over the loss of her mother. She said that her cat was the only family she had left. She told the therapist how every day she talked about shopping. It was the only thing that lifted her spirits and made her feel better. She didn't understand all the hoopla that was being made over her messy kitchen, and she wished her brother and her landlord would leave her alone. She couldn't see that they were trying to help her keep her apartment. Luisa was diagnosed with hoarding disorder, with excessive acquisition and poor insight. Okay, so what is hoarding disorder? So, we've probably all of us have seen those videos on YouTube or Instagram or even watched those series on TV where there are a bunch of people, usually a team of people who are hired to clean these houses that are, full of objects and furniture and trash, and you cannot even walk in because it's all cluttered, right? And basically, the definition of the disorder is difficulty in discarding possessions regardless of their value, right? And the DSM outlines specific criteria for the diagnosis of this disorder, which include distress associated with the thought of discarding items, often resulting in anxiety or fear of error, the build-up of possessions to a degree that hampers the intended use of living spaces, example, bathroom filled with plants rather than being usable for bathing, and functional impairment caused by hoarding, example, social isolation due to reluctance to invite others into a cluttered home. The Simpson. Anyway, the symptoms are not attributable to a medical condition, for example, brain injury. And what is very interesting about this disorder, but pretty much about any disorder, is the level of insight, right? So insight levels can vary from good, so recognizing hoarding as problematic, to poor, which is basically being unaware of the negative impacts, where individuals hold delusional beliefs that their behaviors are not problematic. And that can be a problem because the prognosis is not going to be very good, right? So if you have a good level of insight, the chances of you getting better and seeking treatment and staying in treatment is very high compared to the ones who have poor insight, which is, I don't think I have a problem, I think my house is fine. Yeah. So what does contribute to hoarding disorder? It's usually stress and negative emotions, and often this leads individuals to use acquisition as a coping mechanisms, as the example of Luisa, that this disorder kind of started when her mother died. And many individuals with the disorder display avoidant coping styles, indecisiveness, and an attachment to their possessions, which may stem from dysfunctional beliefs or a perfectionistic approach that basically makes it difficult for the individual to discard even items that are not being used. And anxiety around making mistakes or losing something of potential future value often accompanies these behaviors. And for some individuals, these possessions form a part of their identity, which causes the fear that basically discarding items will be like if you were to be erasing a personal history. The disorder affects approximately 2 to 6% of the US population, with a higher prevalence in men and a notable increase in older adults. And hoarding disorder tends to become more severe with age, with contributing factors including gender, marital status, and co-occurring conditions like anxiety or depression. There is a noted genetic link in hoarding disorder, with 12% of first-degree relatives also affected. Traumatic or stressful life events such as bereavement may trigger or exacerbate hoarding behaviors. And individuals with this disorder may experience a lot of shame or embarrassment, which can obviously impede their willingness to seek for help. And usually clinicians are encouraged to use a supportive and gradual approach, helping clients develop an intrinsic motivation to change. Motivational interviewing and envisioning like goals, such as visualizing a clutter free living space, are effective strategies. And it is also beneficial to collaborate with other professionals, such as contractors that help clean the apartment or the house. And it is important also to talk to the family of the individual who has hoarding behavior, so that everybody can try to help the individual. And obviously, we want to differentiate hoarding from organized collecting. And basically, collecting is just a purposeful way of like collecting little things that you like. It's not like collecting everything and not throwing away things that you actually don't need. And obviously true hoarding disorder involves cluttered spaces that are intended for daily use, like the kitchen or the bathroom. And it can become very disruptive and may also be hazardous due to the accumulation. Hoarding disorder is a chronic condition that often intensifies over time, and most individuals do not pursue treatment again. They're often prompted by family members or housing requirements. Some successful treatments may combine exposure and response prevention therapy, in-home interventions, and cognitive behavioral therapy to basically challenge faulty beliefs surrounding possessions. And basically, the way exposure and response prevention therapy will work is that we gradually expose clients to the anxiety-provoking act of discarding items and resisting to the urge to buy new items. And the therapist helps the client face their fears of loss or regret by discarding specific items in a controlled manner, starting with less significant possessions and then progressing to those with more emotional attachment. And during this process, the client is encouraged to sit with any anxiety or discomfort without giving in to the compulsion to keep or acquire items, which is supposed to help reduce their distress response over time. So what we can do at first is we make the client just visualize and imagine them discarding certain items little by little and cleaning up the house, and so that they become kind of desensitized to throwing away things. And then we also make them visualize the house perfectly clean, with no clutter, and so they can visualize the goal and actually get motivated to start the process. And that is it for this episode. I hope you enjoyed it. And basically, as a summary, hoarding disorder, how does it look like? It looks like a person who has fear and anxiety behind throwing away anything in their house. They keep collecting many things that end up being just clutter in the living room, clutter in the bedroom, clutter in the bathroom, and it becomes very dysfunctional to live in that condition. They just keep buying without throwing anything away, even things that they really don't need or things that they have never used. And if people may have either a poor insight or a very good insight. If you have a very good insight, then it's easier for you to get better and seek treatment and have some substantial result. But if your insight is poor and you think that there's no problem at all and you're just annoyed about the fact that maybe your family wants to help you out with cleaning the apartment, or they want to hire somebody to help you out, or they are suggesting you to go to therapy, then it's very hard for you to get better.